Welcome to Ultrasound and congratulations on your pregnancy. My name is Gemma and I am a sonographer. I am a registered healthcare professional. My job is to use ultrasound equipment to scan your baby and to check their overall well-being and to look for different health conditions. Upon arriving at your chosen hospital, please check in at the reception so that we know you have arrived for your scan. You will then be asked to take a seat in our waiting area. It is important that you drink 1.5 pints of water 1 hour before your scan. Please make sure you keep a full bladder as we need this for your scan. A full bladder helps to move your uterus up and out of your pelvis, allowing us to see your baby more clearly. We can provide an interpreter if you require.
Hiya, would you like to come in for your scan? Am I right to take those maternity notes?
Yeah.
Thank you. So if you just want to lay yourself down on the bed, I'll just get these doors shut.
Once called into the ultrasound room, we will check your personal details and ask you to lay down on our bed and uncover your lower tummy area.
Perfect. So I'm just going to get some tissue. If you wouldn't mind just bringing your trousers down. Yep. If you'd like to just tuck that tissue in just so we don't transfer that jelly all over your clothes. Okay.
We recognise the importance of having a supporting person with you, but we politely ask you to bring only one person and we request no children under the age of 16. Children can be distracting to a sonographer during the scan. If you do bring children to your scan without an appropriate adult to sit outside with them, you will be required to rebook your appointment. Ultrasound scans are important medical examinations to evaluate the health of your baby, which require a high level of concentration. Unfortunately, sometimes the ultrasound findings are not always positive, requiring a sensitive conversation which may be distressing. In most ultrasound rooms, we have screens where you can watch the scan as it is performed, which allows you to see the baby whilst we are scanning. Recording of the ultrasound equipment is strictly prohibited and the use of mobile phones or cameras within the scan room is not allowed. The dating scan. The purpose of this scan is to check if you are expecting more than one baby, determine how many weeks pregnant you are and give you an estimated due date. We will also check your baby's development for this stage. This early scan is performed between 11 and 14 weeks. At this scan, you will be offered the combined screening test for Down syndrome, Edwards syndrome and Patau syndrome. The combined screening test is an optional examination which your midwife will discuss with you at your booking appointment. This test combines the measurements of the pregnancy hormone levels in your blood and a measurement of the fluid behind baby's neck on your ultrasound scan. After the scan, you can empty your bladder. If you are having the screening test, we will tell you where and when you need to go to have your blood test. The anomaly scan, or also known as the anatomy scan, is performed between 18 and 20 plus 6 weeks pregnant. This scan is commonly mistaken for a gender scan, however this scan is actually to check the health and well-being of your baby. During the scan, we use measurements to check your baby's growth and look in detail at baby's bones, heart, brain, spine, face and abdomen. This scan usually takes between 20 and 30 minutes. If we are unable to complete the scan due to the baby's position or any other factors, we may ask you to go for a walk or empty your bladder to try and change your baby's position. Sometimes this doesn't work and we may need to rebook you on another day to complete your scan. Please do not worry, this happens often and does not necessarily mean that there is a problem. We will use an online report to document the results of your scan, where it can be accessed by your midwife. Sometimes we may not be able to get clear images of your baby. This may be due to your baby's position or if you are above average weight. At this scan, we can also check the sex of your baby if you wish. Please let your sonographer know at the start of your scan. Please note that the sex of the baby is not 100% accurate and can only be seen if baby is in a good position. Recently, we have introduced the option to have your baby's gender written down, should you prefer this. We provide this on a pre-written disclaimer form only, and we can pop this into an envelope for you. Most women have 2 scans at 12 and 20 weeks. However, some women may need further scans after 28 weeks to check how baby is growing, the blood flow in the umbilical cord, and the amount of fluid around the baby. These scans are called growth scans and are performed in another department called the Fetal Assessment Unit. If you require a growth scan, your midwife will arrange this. Occasionally, we may need to perform an internal ultrasound scan using a transvaginal ultrasound probe to gain more information about your pregnancy. Internal ultrasound scans are offered for all 3rd trimester scans to assess the placenta. It is your choice to accept or decline an internal examination. However, it can be extremely beneficial and can help us ensure that your pregnancy is managed appropriately. It is hospital policy to have a chaperone present during these intimate examinations. Asking questions is encouraged. Please do not be afraid to ask. We are happy to answer any questions you may have about your scan or advise you who to ask if you think of any other pregnancy-related questions. The 12 and 20-week obstetric scans are screening examinations, and although every attempt is made to exclude an abnormality, a baby may still be born with a condition which is not identified before birth at the ultrasound scan. We will always tell you if there is an unexpected finding on your scan, and sometimes we may need to seek a second opinion. If we do have unexpected findings, you will be referred to a specialist team of healthcare professionals on the same day. The specialist team will explain in more detail what these scan findings mean to you and what it may mean for you and your baby and the next steps that will be offered to you. We welcome your feedback on your experience in our department. Your feedback can be left by the Leeds Teaching Hospitals Trust Friends and Family Test. We aim to take all feedback on board and improve our service for future patients. Finally, congratulations again, and we hope you enjoy your ultrasound experience with us.